close to the end now. We've just got, I think, 2 more clips left. And this clip, we're going to talk about reflex arcs. So I'm going to go to a picture, first of all. Okay, and this is symbolizing what a reflex arc looks like. Now, when we talked earlier, we said that everything has to go into the CNS to be analyzed. Sometimes it doesn't always have to go up to the brain. Sometimes it can just go in and out once it's been established, a reflex arc. And just a sec here. So these are our simplest of all neural responses, all right? And they're automatic, they're predictable. Okay, we think about things like sneezing, blinking. They become our behavioral unit of the nervous system. They help us maintain homeostasis, and they are acquired. Some of them are acquired and some of them are lost as we grow and develop. So there are parts of a reflex arc we should look at. So everything needs to have a receptor, okay? And that receptor has to be able to take a sensory neuron, has to go in to, this is the spinal cord. This darker part here, what you see is cell bodies, okay? So that's where analysis goes on. This is white, and if it's white, then we know that it's axons that are myelinated, and that means information's being transmitted. It can have an interneuron or cannot. Maybe sometimes they don't, and it always has a motor neuron that comes out to an effector. So it has to have at least 4 elements: receptor, afferent, remember that's ingoing, efferent, and effector. Okay, so R, afferent, efferent, and effector. Now some of them will have an interneuron. In that case, it's a 5-step. So what is the function of reflexes? Well, they help us maintain homeostasis. They help us protect us. So we think about blinking, coughing, sneezing. Are they learned? Well, I guess I would say yes, they are learned. We think about when a baby learns to crawl and then he learns to walk. Can he go back to crawling? Not so easy. Sucking is a reflex. Once they learn to drink, it's really hard to suck that bottle anymore. When you drive a car, you develop reflexes that you didn't utilize before. Initially, when you start to drive a car, you would be very conscious about every movement that you're trying to make. And but now you're probably driving, having a cup of coffee, maybe at the stoplight looking at your phone, lots of activity, talking to the person beside you, listening to the radio. So your reflexes, you become to be able to defend them. To a point you can control them, but if you tried not to blink, I'm sure you always will. Okay, just another example. Receptor, sensory. Sometimes the integration is always in the spinal cord. Out, effector. Some other pictures. This is a common one where we hit the tendon here, and the tendon sends a message impulse, and it comes out and causes the muscle to contract, which moves your knee. You've all experienced that. Pain receptor. The pain receptor goes in and tells us to contract our hand. Same ones we just talked about.